Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Clinical features of the uh, clinical features of renal calculi. The main clinical features of renal calculi include: first, the most common symptom is the patient presents with pain. Then, this severity of pain is not related to the size of the stone. Though the size of the stone is very big or it is very small, the pain is can be there. Either it can be small or big. But the site of the obstruction and can determine the site of pain. That means if the obstruction is in the upper ureter, then the pain is referred to the testis. If the obstruction or if the stone is in the middle ureter, then the pain is referred along the iliohypogastric nerve. So if the stone is in the upper ureter, then the pain is referred to the testis. If the stone is in the mid ureter, then if the stone is in the mid ureter, then it is referred along the iliohypogastric nerve. If the stone is in the lower ureter, then it is referred along the ilioinguinal nerve to the thigh, scrotum, and perineum. So wherever the stone is, based on that, we can identify the site of the or nerve or whatever we say. We can identify the pain. The site of pain can help us to identify the site of obstruction. So if the stone is in the bladder, then bladder symptoms can be seen like frequency, urgency, and dysuria. If the stone is in the intramural, then strangury is seen. Strangury is sudden pain. Intramural is if this is the ureter, if the stone is present in the wall of the ureter, that is intramural, then strangury is seen. So that means if the stone is in the upper ureter, then it is radiated to the testis. If the stone is in the middle ureter, then it is radiated to the through the iliohypogastric nerve, it is radiated to the iliac fossa. If the stone is in the lower ureter, then it will radiate to the medial side of the thigh. Okay, so based on this, if the pain is in the medial side of thigh, you can think that the stone is in the lower ureter. The drug of choice for first urinary colic is you can give diclofenac.
thank you and thank you for watching.